question number 19, which of the following is the most likely diagnosis? And right away, we know this is going to be an awful question. So a 45-year-old man presents with nasal congestion, fatigue, and chronic cough. He reports mild shortness of breath and one episode of coughing up blood last week. He denies any history of asthma or seasonal allergies. On physical exam, there's mild nasal septal erosion. So that's interesting. Nasal septal erosion. That's a buzzword that I think most people are familiar with, but we'll go through it. UA reveals microscopic hematuria. So we've got hematuria. So the kidneys are affected. And they said there's a cough with blood. Chest x-ray shows multiple patchy opacities bilaterally. Okay, that's never good. So you got some chest x-ray findings too. Okay, so right, it's one of these fun questions. Everybody hates these. It's just rote memorization. Honestly, there's really not too much logic to this, but I am going to show you what you can do. Let's start with the elephant in the room, the nasal septal erosion. I hope most people watching this thought, okay, maybe this is cocaine abuse, right? So substance abuse. If you did, great, because this definitely can be cocaine. That's a big clue they tend to give you in those types of cases. It's usually a pretty obvious clue though. But if you're thinking cocaine, how are you explaining the multiple patchy opacities bilaterally or the hematuria? You really can't. So that one is definitely out. Next up, let's just go from bottom to top. Sarcoidosis. Sarcoidosis usually does present with chest x-ray findings, or at least it can. Usually it's the bilateral hilar adenopathy. So multiple patchy opacities, maybe not exactly what you're looking for with sarcoid, but still don't rule anything out just based off of that. We should also think, what do we know about sarcoidosis? It affects pretty much everything. It's multi-system disease. Then think about the weird stuff it does. Like it has 1-alpha hydroxylase, so it can activate vitamin D. So we should be looking for our hypercalcemia symptoms, right? Our stones, bones, groans, psych over and undertones. And we just don't have that here. So this one, it doesn't really fit the bill for me. Also doesn't really fit the demographic for sarcoid either. It's usually a middle-aged female, if not African-American female. But I think stems are kind of getting away from the ethnic and racial correlations. So again, don't like just because you saw it in a textbook that's 30 years old doesn't mean that if it's not exactly the way it was written there in a question, doesn't mean you should rule it out because of that. Okay, so now we're down to the terrible ones. We've got our vasculitides here. There's still a little more logic we can apply here. And I want to point it out here. It's the denies any history of asthma or seasonal allergies. If you've ever heard of the term atopy, you can be my new best friend. But atopy is just a really important concept to understand. Atopy is 3 things that you need to know like the back of your hand: allergies, asthma, eczema. It's literally in the name of eczema, atopic dermatitis. So these 3 tend to come together. Do you know someone with asthma? They probably also have allergies and or eczema. Just pay attention that when you get out on wards, you might see patients with allergies who may also have asthma and eczema, or a couple in the combination, or maybe just one, but they do tend to come in pairs like that. These 3 things all share something in common, and that is eosinophils, right? Eosinophils tend to be in charge of the atopic processes. So when you see EGPA, eosinophilic granulomatosis polyangiitis, is along the same lines of atopy, right? Anything with eosinophils tends to go together. So without eosinophils anywhere in our stem, they had microscopic hematuria on the UA, but no mention of eosinophils, no EOs in the CBC. So I am going to rule that one out. Not super confidently, but confidently enough based off of what I know from atopy. And then we're down to 2, GPA and MPA. This is now where we're down to rote memorization. GPA is upper and lower airways affected plus renal involvement. MPA is basically the same thing as GPA, but with no upper airways. Another way to think of it is like no nose. GPA, but no nose is what MPA is. So let's check it out. What do we have here in the stem? We've got our nasal congestion. Okay, so we already know the answer, but we'll keep going. Coughing up blood, probably coming from lower airways, and then our hematuria. So the correct answer is B, GPA.